Good afternoon, everyone, and welcome to our virtual health talk. My name is Melissa, and my pronouns are she, her, and hers. On behalf of the Patient Education and Engagement Program here at the University Health Network, I would like to thank you for attending today's session on preventing falls at home and in the community in celebration of Falls Prevention Month. Before we begin, we'd like to highlight that November is also Lung Cancer Awareness Month, and to let you know about the lung cancer screening program at UHN. If you're between the ages of 55 to 74 years old and have smoked cigarettes for a total of at least 20 years in your lifetime, you might qualify for lung cancer screening. You can get more information about this program by calling 416-340-4154, talking to your doctor, or visiting www.trcp.ca. So thanks, everyone. So now going back to the talk, I would like to take a minute to thank our planning team. The Patient Education and Engagement Program, the Patient Learning and Experience Center staff, the Patient Partners Program, and Education Technology and Media Services. Now, a few words about our online format today. So this session is being recorded and will be available for viewing with closed captioning at the same YouTube link afterwards. Today we'll have a presentation for approximately 35 minutes, and then we'll open it up to the audience to ask questions for the rest of the session. If you have any questions about the live stream during the session, you can email us at pfep@uhn.ca or leave a voicemail at 416-603-6290, and a member of our team will get back to you shortly. And on the topic of technology, we realize anything can happen when it comes to the internet and internet connections. So with that said, should my internet cut out at any point, don't worry, you'll be seeing one of my awesome colleagues step in to facilitate the session. And to submit your questions for the presenters, we invite you to go to the link on your screen. You can also scan the code using your smartphone's camera or QR code reader app. And you can submit questions anytime during the presentation. We want to quickly thank those who have submitted questions already. It helps us see what people are interested in learning about most. And we've tried our best to address these within the presentation, but we'll definitely answer them again during the question and answer period. When you submit your questions, you may notice it doesn't get posted right away. And this is because we're now reviewing questions before they show up for the audience. This will help us make sure questions will be repeated. They give us time to address new and different questions, and it can also help us prepare how to answer the questions before they're posted. A few things we ask you to please keep in mind before you submit your questions are: first, you can choose to include your name or stay anonymous, but please note that others will be able to see your name if you do include it. Please do not include any personal details about your health or condition in your question. Our health talks are for general health information only, and the speakers are not here to diagnose or provide treatment recommendations. We'll try our best to answer as many questions as we can during the question and answer period. And finally, you can also vote for your favorite questions by clicking the thumbs up button beside the question. This will help bring these questions closer to the top, and they'll more likely be answered. We're also excited to let you know that you can enter for a chance to win a $10 Tim Hortons gift card. And to do so, you'll just have to fill out a feedback survey after the talk. The draw will close in a week on Thursday, December 2nd at 2:00 p.m. and we'll draw the name and notify the winner on Friday, December 3rd. We ask that you please make sure you enter your email address correctly, because that's how we'll be contacting you, and to check your spam and junk folders. Now you're probably wondering, how do I fill out a feedback survey? So please go to the link on your screen and complete the survey at the end of the health talk. The link is also available in the description box below, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you straight to the survey. After you complete the survey, you'll then see the link on that confirmation page to enter the draw. And we thank you in advance, because your feedback will help us know what you liked, what we can improve on, and what topics you would like to see in the future. So now moving on to our presenters. So first we'll hear from Paul Morse, who is the former CEO of the Real Property Association of Canada and former Senior Managing Director at Cushman & Wakefield. Paul began his volunteer journey at Heart and Stroke and the UHN Patient Partner Program after a massive ischemic stroke in 2012. After Paul's discharge from the Toronto Rehab Institute in the summer of 2013, Paul realized that his life has changed and that, fortunately, he still had a voice in mind to effectively communicate a patient's perspective on a number of fronts by participating in the Patient Partners Program and also raising awareness of the risk of stroke. He also fundraises in the annual Ride for Heart and Stroke on a Recumbent Trike, where he has created a team called Be Heart Paul. Next, we'll hear from Agnes Kulinik, who completed her Master's of Nursing at the University of Toronto and subsequently earned her gerontological nursing certificate from the Canadian Nurses Association. After a few years in acute care, Agnes migrated to community-based geriatrics care. As the clinical coordinator with the Independence at Home community outreach team since it started in 2016, Agnes works on an interprofessional team to support community dwelling, frail older adults in their goal to age in place. She enjoys traveling to various corners of the city, often on her bike, learning about and collaboratively achieving each older adult's definition of health and happiness. And then we'll hear from Karen Azevedo, who is an occupational therapist who currently works at Toronto Western Hospital in the acute care units. She has previously worked in the States and has practiced in various areas across the spectrum of healthcare, including rehab, outpatient, intensive care unit, acute care, and community. Most relevant for this presentation is that she was the occupational therapist for the Falls Prevention Program when it ran at Toronto Western, and later initiated and ran the Falls Prevention Program for the Toronto Western Family Health Team. So we have a wonderful group of experts and speakers today. And before we get started, I would like to take a moment to acknowledge the sacred land on which the University Health Network operates. At UHN, we strive to provide safe and inclusive care, and that begins by honoring Indigenous peoples. Indigenous peoples are the original inhabitants of this land and have, for thousands of years, have cared for this land. Although we're presenting this health talk in the digital world today, we want to acknowledge and remind ourselves and encourage you to do the same too, wherever you're currently located, that we're still on the traditional territory of many nations, including the Huron-Wendat, the Haudenosaunee, and the Mississaugas of the Credit River. This territory is governed by the Dish with One Spoon Wampum Belt Treaty, an agreement to share, care for, and protect the resources around the Great Lakes in peace and respect. Today, this territory is still the home to many Indigenous peoples from across Turtle Island, and we're very grateful to have the opportunity to work, learn, and play on this territory. So now enough from me, I'll now hand it over to Paul, who will be starting us off. Paul, you're on mute right now.
Thank you for inviting me to participate in the Fall Prevention Program as part of the Health Talk today, Melissa. My name is Paul Morse. I'm a stroke survivor, now in my 9th bonus year after suffering an ischemic stroke in November 2012. In the last 8.5 years, I've had quite a bit of experience with falling as well. And because I am hemiplegic on the left side, which means I have very little voluntary control of my left leg, arm, ankles, toes, it is very difficult, if not impossible, for me to get up on my own. But my goal today is to share with you some of the experience that I've had, hoping that it might be helpful to you in your journey. First thing I should say is that walking has been and remains an important part of my life. I walk every day and try to achieve a goal of at least 3,000 steps per day. Walking is one of the few things I can do to improve my cardio, and it's been proven that it does help through a program I was involved with at Rumsey Center, maintain my weight and overall positive attitude and strength. I currently work with a neurophysiotherapist and personal trainer twice a week on ways to improve my walking and reduce the risk of falling. Having said that, there's always a risk of falling when you walk, and I decided the risk reward is worth it. And because of the hemiplegic condition I'm in, I am very careful and employ a couple of tools and strategies that have been very helpful. Tools, I have grab bars in my stand-up shower and in washrooms. And in terms of strategies, first thing I do every time I stand up is an awareness check. How am I feeling? Any sign of dizziness? I use a walking pole, which is probably more of a tool, to help me stand straighter. and maintain an upright posture. Initially, I used a cane, but I found that, or my physiotherapist pointed out that I was walking like the Hunchback of Notre Dame. So the pole helps me stand straighter. And it's also, I found, is a very effective tool in case I stumble, which I do. An awareness check, which we probably should start with an occupational therapist checking your home or your apartment to make sure that there aren't any obvious signs of or risks that you might encounter. But for me, that has been checked out where I live. So the awareness check really involves my dizziness or any condition that I may be feeling. If I'm too tired, I sit down. If it's too hot outside, too cold, it's better for me to stay home. If I see any obstacles, especially outside, then I have to take that into account when I'm walking. Anything that could cause me to slip and fall, I also wear an Apple Watch, which I guess you could call as a tool, with the cell phone feature built in. I bought that, and that's proven to be really effective for me. It's expensive, and there are other options, but when I fell in Florida last year, it was the only way I could reach someone for help to come and get me. So I would recommend that if you can buy one or care to buy one. The other strategy I have is not to multitask when walking. I don't need to carry my iPad and a cup of coffee at the same time in one hand. I can take 2 trips. And if walking is not part of your routine, then I would encourage you to start modestly. Take 100 steps a day and work yourself up slowly over a number of weeks, even months. Remember, you're on a marathon, not a sprint. And I think if you keep that in mind and be patient with yourself as you encounter the new reality that you're in, then I think you're well on your way to avoiding a fall. If you have any questions or areas that you care to ask, you're more than welcome through Melissa, and Melissa will forward them on to me if necessary. Thank you.
Thank you, Paul. Thank you for sharing your experiences and tips and tools with us. I'm sure many of us found it helpful, and it inspired us to think a little bit more about tools we can use. And I really like the strategy you shared about doing an awareness check. That's great. Thank you. So now we'll be building on what we learned from Paul, and we'll hear from Agnes and Karen, who will share their expertise around why it's important to prevent falls, causes of falls, how to prevent falls at home and in the community, and then share some resources at UHN and in the community where you can learn some more. So over to you, Agnes.
Thanks so much, Melissa. So first we're going to talk about why is it important to prevent falls? Why do we care about preventing falls? So let's go over some stats. So injuries that result from falls in Canada, undeniably, they're a serious concern. They're the leading cause of hospitalization for children, young adults, and seniors. In fact, 20 to 30% of seniors fall each year. So increased age actually does put us at increased risk for falls. Speaking more about seniors, falls cause 85% of seniors injury-related hospitalization and 95% of all hip fractures. It's pretty significant. And the impact there is over 1/3 of seniors are admitted to long-term care following hospitalization for a fall. So there's chronic pain, often that we're seeing reduced mobility, loss of independence, and even there's mortality, there's death associated with falls. So it has a huge impact on a person that's experiencing falls. Falls are also expensive. From a numbers perspective, $2 billion a year that falls cost in direct healthcare costs. It impacts not just the person, it impacts their family, friends, care providers, all that sort of news to share with you that the positive thing is that falls can be prevented and we can take action to decrease our risk for future falls. Okay, now a little bit more about why are falls happening? What is causing falls? So there are many factors that can cause a fall. We'll be looking at those. So certain medications that a person may be taking, there might be drowsiness or dizziness as a side effect, and then that can increase the risk for falls. We need our eyes to see what's in front of us, the depth in front of us. So if someone has reduced vision, this can also increase the risk for falls. Something that's very interesting, a fear of falling can also increase our risk for fall. And the reason is because this can lead to a cycle where the fear then also leads to decreased activity, which then leads to decreased function. So being careful to the point that you're not using your muscles and exercising can also put you at risk for a fall. Someone who might have issues with their gait or with their balance, so how they're walking, how steady they are, that can also cause increased risk for falls. Some more of these reasons. So there's many reasons that we can potentially be seeing falls. So decreased strength and endurance. We also want to take a look at the external environment. So there might be poor weather, unsafe home environment, uneven sidewalk. Also certain health conditions that we might be living with, such as neuropathy, osteoporosis, high or low blood pressure, certainly also increase our risk for falls. And then lastly, poor nutrition or dehydration. Something that I'd like to add to the risk factors is that there are times that we can identify the reason for a fall. Like it's just very straightforward. We can trace it back. However, more often than not, there's many different things going on. So for instance, if somebody just had a fall, we're seeing maybe there's dehydration that happened. There maybe was also a specific medical event. The person was also getting up to go to the bathroom at night. So there's different things that are going on that can increase our risk for falls. There's things that we can change, so modifiable risk factors, and also non-modifiable risk factors. Things that are a little bit harder to change are health conditions, the medications that we speak to our team that are really important for our care. Those are things that are a bit harder to change. The important thing is to acknowledge what puts you or your loved one at risk for a fall, and then focusing on what you can change, taking action on that, and then you're decreasing your risk for future falls. And now over to you, Karen, on the topic of how to prevent falls.
Thanks, Agnes. So in terms of how to prevent falls, I think it's important to actually know where falls are happening. So 50% of all falls actually happen at home. And of those falls that are happening at home, the most common places are in the bathroom and on the stairs. Those tend to be where most falls are happening. It's also important to acknowledge that an older adult, when they change their familiar environment, so maybe they are in hospital for a week or something like that, sometimes that change in environment can also cause a fall. So when we look at our homes and realizing that 50% of falls actually happen at home, it's important to actually look at what potential hazards are present in the home that can increase the risk of falling. So we want to check out what these potential hazards. And then the other thing, based on what even Agnes was mentioning, there's modifiable ways of addressing falls. There's two things that we can do. We can change the way we do an activity. And Paul gave some really great examples of that. He mentioned sitting when he's very tired instead of standing for the long stretches to do an activity, or not multitasking. Those are great examples of how you can change a way you do an activity. The other way of changing is changing the environment you're in. So I thought we'd take a look at different rooms in a house and identify these potential hazards, because it really is a bit of a skill or practice, especially if you've lived in this environment for a long time. You might not necessarily identify these as hazards. So let's take a look at this living room. Here's a few things that could potentially be hazards in your living room. So if you look behind the couch, there's some disorganized cords. There's scatter rugs on the floor. Considering the chair that you sit in is actually quite important. Does the chair that you have armrests? Are they too low? Is it a rocking chair that can be difficult to get up from? How's the lighting in the room? Is there significant lighting that will allow you to see in any kind of environment, even if it's night? Are there things on the floor that could potentially cause you to be at risk of falling? Is the furniture too low that you might actually, if your vision is obstructed, miss it? But there are things that we can do to actually make the environment safer, even if you do have pieces of furniture that you're very attached to. It doesn't mean that you do have, preferably you would remove scatter rugs and you throw those rugs out, or place them somewhere, give them away to loved ones. But there are other things, if you're, adamant that this rug means something to you, there's ways that you can kind of do things that can allow you to keep these pieces of furniture or rugs in your house. So you can get tape rugs that actually secure the rug to your floor. You can remove clutter. You can organize the cords behind a cord organizer that helps to reduce the tripping risk. You can raise height to a furniture, and we'll actually show you some examples of that. Make sure that there's enough lighting, and consider what you're wearing on your feet. So proper indoor footwear is actually important. It's also important to consider that as you age, your height and posture might change over time. So this can affect how clothing actually fits you. So maybe you've lost some weight and your pants are actually a bit longer than you are used to, or your height has changed, and so these dressing gowns and pants are a bit longer and become tripping hazards. Consider the footwear that you're wearing. Are they contributing to falls? Do they have non-skid bottoms? And the other thing that can cause falls, if you're carrying bags such as handbags or laundry basket with both your hands, so that you're not able to see the floor of the stairs. Those all can contribute to falling, and if you change the way you're doing that, you might be able to change or reduce the risk of a fall. So here's a quick overview about shoes. You want to make sure that whatever shoes you're wearing has a back to them, because sometimes, otherwise, if you're in a bit of a rush or you're walking, your foot might slip out of the shoe, and cause an actual fall if your balance is not very good. You want something that has a good grip on the floor, but does not stick to the carpet or floor. And just one thing about, ideally you want this to be easy and something that you can slip in easily. If you do have a shoe that has laces or Velcro, you can also get elastic laces that can make your shoe kind of slip on rather than having to tie your laces every time. So these are some examples of chair blocks that you can place under your furniture if you're very tied to the furniture that you have at home, but they're a bit low and you can't get out of the chair easily. This is a way of kind of adapting it. So you can put chair blocks to raise the height of the surface. The higher the surface is, the easier it can be to get out of them. And a few other examples of how you can get out of surfaces that are maybe a bit too low. You can get a safety pole, like the example on the right. This is tension mounted to the ceiling and helps you actually pull up on something securely so that you can get off a low couch. Typically, we're creatures of habit, so we'll sit in one particular spot all the time. So if you find that that's the area that you get stuck in most of the time, but you really want to keep sitting there, this might be an option for you. The other option, if you want to get a chair, such as the one on the left, these are great options because they can be a recliner chair, but they also have a remote control that can help you give you a bit of assist to stand up. So let's look at stairs, the other place that's very common for falls. So you can see here, there's quite a few potential hazards. So one, the scatter rug on the bottom that we already talked about. This is quite a long flight of stairs. And if you're somebody who has a low endurance, this can be quite tiring. You've got limited lighting up above you. There's only one railing. There's lots of distractions on that wall that could potentially cause you, if you're not paying attention and paying more attention to the wall, you might have a trip on the stairs. And it's hard to really tell where one step ends and one begins. So here's some examples of, what you can do on stairs. So you want to make sure that especially for outdoor stairs, that your stairs are, maintained properly, that they're sturdy. For indoor stairs, you kind of want to make sure that you have light switches both on top and the bottom of the stairs so that you can, you're not walking through them in the dark. You want to kind of minimize distractions as well as identify where one step ends and one begins by potentially marking the edges of the steps. For railings, you want to try and keep your railings to a comfortable grip. So that's usually no more than 6.25 inches around the width of the railing. And as I mentioned, you want to kind of make sure that you can identify, especially with people who have low vision or vision issues, it can be harder to see where one step ends and the next begins. So it's really nice to mark that with textured tape. Potential hazards in the bathroom. So this is a really good example of a small kind of bathroom that you might find in an old Toronto house. You can see that everything is kind of really shiny. And that's already indicating that there might be a lot of issues with potential slipperiness. So try to have some non-slip bath mats around. The toilet looks quite low, and there's nothing really to help you get on or off that toilet. Everything here in this bathroom seems to be white on white on white. So that can be a little bit difficult if you're having visual issues, which happens as you age as well. The lighting is not really helping matters in this bathroom, very limited lighting. And then you can see there's nothing really helping somebody get in and out or out of the bathtub. So if your mobility is challenged, this could be slippery and difficult. So there are some options for you. The chair that you see on the left, this is actually called a transfer bench. And this is more for somebody who might have difficulty getting in and out of the tub. So you would have two legs placed inside the tub, two legs outside the tub, and you sit on one edge and then kind of scoop over. And so it's a lot easier to raise your legs in and out of the tub when you're sitting. So that's the purpose of that. On the right here, you see some examples of grab bars. This can also help you get in and out. And then here's an example of a bath mat that can make things, non-slippery. The chair that you see on the right is a bit different from the previous chair in the sense that it is more for somebody who doesn't have trouble getting in and out of the tub, but might have endurance issues. So maybe they can't stand, maybe you can't stand for long enough in the shower, or you're concerned about your balance when you're standing. This is another option which reduces your risk of falling, because you can sit and then attend to your shower. And the nice thing about that is that they give you accessories as well. So the slide that you, if we move on to the next slide, you can see the accessories. You can have handlebars to help you get up and down that shower chair. And there's also even places that you can put your shower head in. These are toilet adaptations. So the picture on the right is a raised toilet seat. This is for somebody, the higher the surface, as I mentioned before, the easier it is to get off a surface. So this is where this can come into handy. The picture on the left, which is a Versa frame, this is more for somebody who might be more like me, vertically challenged or short. You want to make sure that when you're sitting on the toilet, your feet can still touch the ground, because that's what we kind of need in terms of being able to use the toilet appropriately. So a Versa frame like this for somebody who's shorter gives somebody the arm rests that you need to get up off it without necessarily raising the height of the toilet. Here's a kitchen. A kitchen, again, lots of potential issues here. If you look at the stove, you can see that the dials are white and the stove is white. So again, visual challenges, which happens to us as we, get older. It might be difficult to see those dials appropriately. You can see the cabinets here very high, and so it might be hard for someone who, short or tall, especially in this height of cabinets, might have difficulty getting stuff off the shelves. So it would be recommended that if you're using, frequently used items, should probably be within reach and easy to grab places where you're not really being thrown off your balance to get these items. I could say the same for the fridge. When you open the fridge, to place the heavier gallons in arm's reach, essentially, so that you're not having to do any excessive bending or excessive reaching to get heavier items. Lighting, again, is important. So you can see sometimes with the windows, such as the one placed in this kitchen, with sunlight coming in, glare can actually impact your ability to see everything clearly. Here's a bedroom again. This, the scatter rugs again are an issue in this bedroom if they aren't securely attached to the floor. Light switches. I don't see anything by the bed, so that potentially means that there's no light switch there. That means you have to remember to turn on the night light before the lamp by the bed in order to get to the bed in brightness. Otherwise, you might be walking or tempted to walk to the bed in the dark, which might cause you to have a fall. And getting in and out of the bed, you really want to make sure that it's the right height for you, not too high, not too low that you won't be able to get out of. Lighting, again, is important, so consider where you place your lights. So look to see if there's anything that can increase your risk for falls. Consider ways to actually reduce the risk by changing the environment or the way you do a task. sometimes if you are concerned about your potential falls risk, there are ways that you can actually get an occupational therapist to come and assess your home environment, and you can do so if you're already integrated with the LIN, or if you have some PSW support, you have a LIN coordinator assigned to you, and you can always let them know that you would like a home OT assessment, and they can send out an occupational therapist to come and assess your home. The other way to do that, if you don't have a coordinator or you just don't know how to get a hold of them, is asking your family doctor to request an OT assessment for you through the LIN.
Thanks, Karen. What I wanted to also touch on is sort of risk mitigation or sort of risk management. So if you do have a fall, accessing help is really important. So a couple pointers about that is keeping a telephone in each room if possible, having your cordless phones or mobile device charged, emergency numbers ready, easy to find and up to date. Lots of people find a phone that is sort of a vision-friendly phone, easier to use. And you can also set up an emergency response system. So this is what it is, a personal emergency alert system. A little bit about this tool, which is so handy. It's something that you pay for monthly. It doesn't call 911 right away. You'll press it if you have a fall, really if you're just not feeling well and you need to talk to somebody to take action. When you press it, you talk to an operator who then decides if a neighbor or loved one or the emergency service should be called. And they are available as a waterproof watch or pendant style. And there are a lot of different companies that offer this product, this service. So if you just do an internet search, there's you'll find quite a few. Preventing falls outside of your home. So we've spoken about how to keep yourself safe inside of your home. Outside, you do want to dress according to the weather, have appropriate footwear, paying attention to road signs and signals, planning ahead and taking your time wherever you need to go, being aware of traffic, watching for uneven pavement. And then if your healthcare provider had recommended a walker or a cane for you to use, then using it keeps you safe outside as well. And using a buggy to carry things to keep your hands free and to make things easier for you.
Thank you, Agnes, and thank you, Karen, for sharing the tips and strategies with us. So as you mentioned, as you're going outside and with winter right around the corner, many of you may be wondering more and more how you can prevent slips and falls when you're outside, especially when it starts snowing. So now we'll spend a couple minutes talking about Rate My Treads on behalf of Dr. Tilak Dutta, who is a scientist at KITE. So that's the research arm of UHN's Toronto Rehab. He and his team have been researching extensively on different types of footwear that can help reduce and prevent unintentional slips and falls. In fact, you may have seen some of their work in a recent CBC Marketplace article this past week. Unfortunately, Tilak couldn't attend today's health talk, but he has graciously prepared some content for us to share with you. So what is the goal of their work? So taking a step back, let's start with an example. So when you go to buy snow tires for your car, you'll see a symbol on the side of the tires that looks like a mountain with a snowflake inside it. So this tells you that the product has been tested and has been shown to perform well in icing conditions. So their team wanted to create the exact same thing, but for winter footwear. So if we take a look here, they do this by testing different types and brands of winter footwear using the maximum achievable angle or MAA test. And this determines the maximum icy slope that a pair of boots can climb without slipping. So some boots like this one in this video that we'll play shortly start to slip at 1 or 2 degree angle. and others can climb up to a 20-degree slope. So we'll see that in this video. So as you can see from that pair of boots, they were able to withstand the ice at a sharper angle. So what they've learned through this testing is that there's a wide range of footwear performance in the boots that you can buy, and it's impossible to tell just by looking at them how well they'll perform. So that's why they needed to test them. And so you can see the results of all of their tests on ratemytreads.com, and each boot gets an MAA score, which is that angle we were talking about that shows how they're able to climb in the test without slipping on two ice conditions. So that's melting ice and cold ice. The boots also get a rating out of 3 snowflakes. So 1 snowflake means the boot had a score of 7 to 10, 2 snowflakes are for scores of 11 to 15, and 3 snowflakes are for scores over 15 degrees. So those are the ones that you probably want to look for. And this is a great resource to help you decide which footwear to buy. And you can read more about the research process and also see these results on their website, or you can email Tilak directly at tilak.dutta@uhm.ca. Now I'll hand it back over to Agnes, who will tell us about resources and programs over the next 1 or 2 minutes.
Excellent. So we've listened to the presentation. What about going forward? Where can we go for more information and support? As we mentioned, home and community care, please do connect with them if an in-home assessment would be appropriate for you. This can help you reduce your risk of falls in the home. Here at UHN, we do have a falls prevention program. It is an 8-week program that's held at Toronto Rehab, so on University Avenue. It does include a one-to-one assessment and also falls prevention education. And you can find more information on their website and have your doctor send in a referral. Community exercise programs. So these are amazing resources. It's really worth checking out if your local seniors agency or your local community center offers exercise. Hopefully these will start opening up more and more. I've seen lots of virtual programs as well. So different types of exercise: Tai Chi, chair yoga, chair fit. A great resource. These are some videos that you can very easily take a look at. It's an exercise program designed by physiotherapists for people with MS and other mobility issues. So it looks like 45-minute or even 15 to 45-minute standing and seated aerobic and strengthening exercises. So do check it out. Physiotherapy clinics. Physiotherapists are awesome. They can provide a lot of support to help you improve your strength and balance. You can go the private or the publicly funded, so OHIP funded clinics in the community. Regarding OHIP funded clinics, there are eligibility criteria, so please do take a look at that. And if you still can't find what you're looking for, you're always welcome to connect with UHN patient and family libraries. You can give them a call, you can email them, and you can also visit them. Would like to leave it on a very high note that you can prevent falls, so making sure that your home is safe. Again, proper lighting, keeping things organized and off the floor, recognizing the role of assistive equipment and devices to help you with your day-to-day activities, and keep yourself healthy. take a look at your medications, your chronic conditions, if you have any, and also considering what exercise would be appropriate for you.
Thank you, Agnes. So on behalf of our participants in the patient education program, thank you so much, Paul, Karen, and Agnes for sharing your expertise and experience about preventing falls with us. So we'll now check out the Slido to see what questions have been submitted. And you can still submit questions if you haven't already. So just go to the link on your screen, or you can again scan the code using your smartphone's camera or QR code reader app. So let's take a look at the first question. So this person has asked, so clutter is something which gets in my way and can be a hazard as I age. Are there any public agencies which will help me as a senior to deal with this without having to deal with unregulated professional organizers? I'd be willing to pay for help, but find organizers are in too much of a hurry. I think I'll turn this one over to you, Agnes, to get us started.
Yes, thank you. This is a great question because absolutely clutter is something that can get in the way and be a hazard. In terms of supports in the community that I often try out first is home help through community seniors agencies. So sometimes there's some subsidy involved, which is a bonus. So please do connect with Toronto Seniors Helpline or your local 211 to find out, based on where you live, what agency or what community program might offer some home help, and do be as explicit as possible about the help that you need to make sure it's a good match.
Thank you, Agnes. And you can also contact the patient libraries too, and they're happy to help connect you with these numbers and contacts as well. Okay, so the next question. This person has asked, as an adult child of an aging parent who lives independently but was fallen in the past year, how do I talk about falls prevention in a respectful manner? I find my parent tries to dismiss my concerns or put off the conversation altogether.
Yeah, this is such a great question. I love that, you know, whoever asked this question is trying to address it in a very respectful manner. Ultimately, it becomes the person's, you know, right to kind of accept the help or acknowledge that they have a issue. But I would encourage you to kind of keep bringing this up. Maybe share this talk with them and see if that could stem or start off a good conversation point in terms of like any interest in adaptive equipment, or maybe a home OT assessment, or potentially even you know, exploring some of the fall prevention programs, which are great community resources. It's great to actually hear other people's sharings of how they prevent falls. Paul had some great strategies that he's used. So this might be a great way to actually start the conversation by just having a talk or sharing a video, or starting the conversation there.
Thanks, Karen. I really like what you said about sharing resources as a start. That's a great way to start that discussion. Thank you. Okay, next question. There are two questions here. So what are some tips to prevent a fall, and what are easy things I can change, update, or do at my parents' house to make it safer for them? So I think I might hand this one over back to you, Karen, because this was something you had touched on earlier.
Yeah, I think just even starting with just talking about how can I reduce some of the risk factors of what could potentially you know, cause me to have a fall. You're never going to 100% prevent a fall, but you can definitely reduce the risk of having a fall. So maybe going through the house and even just using some of the tips that we talked about in this presentation to take a look at your environment. We don't tend to look at our environments because they're what we are used to, what we've been living with. And sometimes an outside eye can be really helpful, coming in there and giving you ideas of what potentially could be safer ways of doing things. So I would really encourage you, to maybe have a real look-see in the house to see what could potentially be a hazard. Maybe get an opinion from an occupational therapist to come into the house and do a walkthrough and reduce those risks. And anything that you change or update, grab bars are always a great idea, especially in the bathroom. I think that's a good place to start. I would suggest having somebody come in, walk through it, and really recommend based on your parents' mobility issues currently, if there are any, where those grab bars would be the best place to kind of put them. So having an occupational therapist walk through the house would be great.
Thanks, Karen. Okay, our next question. Have you noticed trends in causes of falls in younger middle-aged adults? Is there much education or awareness done to prevent falls in this group? So these are people with certain health conditions or on certain medications, disabilities, after a procedure, giving birth, new parents, substance use.
I'll share this one. I know that we did present some data on falls in older adults. So yes, certainly within the younger to middle-aged adults population, falls are an issue as well. And just because there aren't readily available stats or trends about incidence or prevalence, like how often it's happening or to whom, that doesn't mean it's not an issue. And certainly, absolutely, like when we take a look at the different risk factors that we spoke about as they're related to falls, these can exist for people of various ages. So the same sort of tips and tricks do apply as well, and the resources can be sought out for that. I know that with different health or medical conditions, there are often organizations built to provide various supports. So I wonder also if falls is a discussion point there.
Thanks, Agnes. That's a great point. And especially for the second question, I think really talking to your doctor or your healthcare team, if you have concerns about falls, if you fall into any of these groups, then it's definitely worth talking about because they'll provide some strategies or even resources for you to look into. Thank you. Okay. So the next question asks, how do I know it is time to talk about falls prevention with my aging parent?
I think a good way of looking at it is, are you noticing changes in their mobility, in their abilities in terms of how they're functioning? Are they telling you that they're having falls? Certainly not every aging parent is having falls to the point where you're having to talk about falls prevention. I mean, certainly, as we mentioned in the question before, everybody is at risk of falls, right? Not just the elderly. And so if somebody is telling you that they had a fall, it's getting to the root of the issue. Was it something that is happening frequently? Is it because there's a change in their mobility? Was it purely, they didn't have the proper footwear and they were walking on ice and slept? So it's important to actually look at what's causing the falls. Not all falls are the same. Is it a medication issue? So I think having the conversation is probably the great first step. So looking at, what's going around that. And as the previous person who had posted a question sad, doing so respectfully. I think the more respectful we are about having these conversations and the more open we are to have them and really understanding the person who we are talking with, can make the person who is having the fall much more open to actually seek changes or doing something about it.
Thank you, Karen. Agnes, did you have anything that you wanted to add?
I would just wanted to add that talking about falls prevention is sort of sometimes like it's just good to group it under this general idea of independence and safety at home. So all these sort of tips that we've spoken about a home environment or reviewing medications or strengthening, it's generally, it's so entwined with well-being as we are living at home safely. So I think that can happen, that conversation can happen with many people if there is a history of falls or even beforehand, before there are any falls.
Thank you. And this just brings to mind too, do you have any tips on like ways to start this conversation or even prompts that people can use to start talking to a parent or a loved one about this?
Yes, so I always love to do two things, which is bringing forward and acknowledging this person's strengths in maintaining their independence, function, safety. So what are they already doing that you notice and you really admire and you're so happy and proud that they're doing that? And then also listening to some of their concerns in this area and providing some empathy, some understanding, and having a common place to work from in order to address their concerns, and then certainly, of course, sharing your concerns.
Thanks, Agnes. So now I notice that it's 1:57, so unfortunately we'll have to wrap up our session. But thank you, Paul, Agnes, and Karen again for answering our questions and for everyone else for also submitting the questions. If we didn't get a chance to answer your question, we're really sorry, but please email us at pfep@uhn.ca and we'll try to respond within 1 week. So if you have a question specifically for any of our speakers, we'll be happy to share it with them and get a response for you. So there is still a chance to ask your question. And again, your feedback is important to us, so please go to the link on your screen and complete the survey, or you can scan the code using your smartphone's camera or QR code reader app, and it'll take you to this survey. Again, after talk, you can fill out a chance to win a $10 Tim Hortons gift card if you fill it out, and the link to do that will be on the confirmation page of your completed survey. And again, this draw will close on Thursday, December 2nd at 2:00 p.m. and we'll draw the name and notify the winner on Friday, December 3rd. So please make sure to enter your email address correctly because that's how we'll be contacting you, and to check your spam and junk folders at the end of next week. And finally, to find out about our next talk, subscribe to our MailChimp e-newsletter and get up-to-date information about events and new resources at UHN. To fill out a form to subscribe, please go to the link on your screen. This link will also be available on the confirmation page of your feedback survey. So if you're filling out that survey right now, you'll be able to get a link to this one too. Again, thank you so much, Karen, Agnes, and Paul, for speaking at our health talk today and providing such helpful information. I know, speaking on behalf of everyone else, I found it really helpful and inspiring, and it's given me a lot of resources and tips to think about for myself and even my own family. And thank you, everyone, to our audience for attending today's health talk. We will be taking a break in December, but we hope to see you at our next one in the new year. Thank you.